Hello everyone, and welcome to another episode of Protest and Promise. My name is Lisa Salazar, and I am the General Manager of the Youth Development Department. Every month we engage with members of the Olivia E. Mitchell LA City Youth Council, which is represented by all 15 council districts. Youth Council members are here with us today for this very special segment, along with a variety of guests representing the public and private sector to discuss issues of importance to people living in our city. Allow me to take a moment to introduce the Youth Council members that are here today virtually. And if you all could just introduce yourselves, we'll start with Monica.
Hi everyone, I'm Monica. I'm the youth representative from City District 8.
Welcome, Monica. Zaid?
Hi everyone, my name is Zaid and I represent Council District 2.
All right, Asha.
Hi, I'm Asha and I represent Council District 10.
Daniela?
Hi, I'm Daniela and I represent Council District 15.
And Kimari.
Hello, my name is Kimari and I represent District 9.
All right, welcome. Welcome all five of you, and thank you for being a part of today's episode, which is focused on mental health. We're really lucky today to have representatives from the Los Angeles Trust for Children's Health here in studio. Allow me to introduce our guests. We have Executive Director Mary Jane Puffer, who's joined by Noé Rivera, who is a Program Manager. So welcome to Protest and Promise.
Thanks for having us here. This is a really important topic to us.
Great.
We're honored.
Awesome, awesome. So we're really excited to learn about the work of the Children's Trust for Health, about your roles, and also, or most especially, to learn about some of the special programs and initiatives you have for students here in Los Angeles.
Yeah, so I guess I could give you an overview of the organization. We're a nonprofit that was created for LA Unified to help support health and wellness programs back in 1991. And back at that time, it was really about like just getting health care access. So like primary care services on school campuses for kids with asthma who needed support for vision or hearing or, you know, diabetes management,
Right.
and so on. But the focus back then was not so much mental health.
Right.
As we have evolved, you know, there was advocacy to create wellness centers on school campuses in the identified areas with the highest need across LA County. And one component of that model is that not only would primary care, dental, and mental health be provided for young people on their school campus, but the community members could also access that service.
Wow.
And the other component of it was that every site needed to have a student advisory board. So young people who are here today informing what should happen for young people on the school campuses.
That's
and
great.
That's a super valuable aspect, I think, of our programming.
That's great. And does that youth voice create sort of like different priorities in terms of services by Wellness Center?
Yes, yes. So every student advisory board is represented by a different school. So the culture of every school is different. So the young people who represent and live in the community represent the issues and concerns of that community. But Noé can speak to this because mental health is just like overwhelmingly our number one issue.
Right.
Yeah, so across all of our student advisory boards, what we're noticing is the students are actually taking charge. So a big part of what we do at the Trust is empowering our students to allow them to be able to work within their school site and really elevate the issues. One of our students so quaintly stated, adults love to tell me what to do and no one listens what I would like to do.
Yep.
So a big part of our program is to allow the students to let us know how can we support them. Because we're sitting here in these offices making these decisions, but the students should be the ones allowed to make that decision about where they're going to go.
So what are some of the programs and initiatives that you all are running right now?
Yeah, so of course the Student Advisory Board work is across 15 campuses right now, soon to expand to about 10 additional campuses within this school year. So that's big.
Yep.
But we coordinate with the community partners. So like the clinic partners, the mental health providers, we're actually working on a youth mental health collaborative. So we surveyed students about what should the system look like for them and what's the most important aspect of that. And overwhelmingly, the data on there is they want peer-to-peer development. They want to be the advocates. They want to be the navigators, and we're responding to that. We also do a lot of work around oral health. So honestly, like oral health is another, we don't think of mental health and oral health, but if you don't have teeth, you can't get a job. If you have an abscess in your mouth, have extraordinary pain, you can't learn in school. So it's the interconnectedness. It's really this holistic health aspect.
That's really good. That's really good. And you're treating the whole student, mind and body. So I mean, that's fantastic. What kinds of things do the student advisory board, what do they do on campus? Like, what does that look like?
So the student advisory boards, they meet once or twice a week for roughly 1 to 2 hours, and they learn about different healthcare topics, different mental health topics. They come together, it's typically 8 to 12 individuals. They come together, they learn about these topics, and then they go out and they put it back into the school site. So they really advocate to their peers about what's going on. So if this month we're studying HIV, so the individuals learn about HIV through trainings and presentations through our partners. We have a partnership with UCLA. We have a great fellowship there who supports us in training these students every other Friday for 1 hour on different mental health topics. The students then take that information back to the school site, and they do it through tabling events. So they'll sit during lunch, they'll speak to their peers, they'll engage with them, and they'll let them know what's going on. So we're really, the way that we look at it is the student advisory board is really empowering their peers through knowledge. One of the same student who I was talking about earlier, he stated, often we learn that we can get STIs, for an example, from engaging in intercourse, but we never learn how to not get it, right? So if we're going to do it, how are we going to do it right? So that's a big part of the student advisory board, is to teach them, this can happen, but this is how you can prevent it also.
Got it. Well, that's great. And 15 currently operating, 10 more coming on board. So we'll have 25 throughout the school district. And, I'm sure there's a need to continue to grow that. So it's really great work. Thank you for sharing that with us and providing that context to the work that you do. So I know that our youth council members have prepared some questions for you. These are youth council members who have particular interest in mental health and want to learn more. So I think we're going to kick it off with a question from Monica.
Yeah, hi. Thank you guys so much for coming in today. We really appreciate your insight. Los Angeles is known as the cultural hub of the Pacific Rim, with people from over 140 countries and over 220 languages spoken. How is LA Trust for Children's Health taking that into account, taking cultural competence into account within their mental health resources and developing interventions that are also culturally sensitive?
Okay, so I will say this, that the student advisory boards are really based in the community that they live in. So the issues that bubble up from the community are really attended to. Things like, the way that young people would approach, grieving and loss is big. And that happened a lot for young people during COVID. So, the way a Latino family is going to grieve is different than the way a Hmong family would grieve, and so on. But really helping them, embrace those practices, I think, is part of it. Whatever it is that helps that young person, settle in their soul, in the way that they are rooted, I think is really critical. And I think that's elevated in the work because it's local. It's local.
Not only that, a lot of the students that are part of the student advisory board, they come from all different parts of LA. They're a part of all different types of cultures. They look differently, and they elevate what they want. A lot of the students will let us know that they feel fearful of going to wellness center clinics or feel fearful of getting therapy because the person that there's being the therapist for them or is going to be supporting them doesn't look like them. They won't get what's going on at my house because they didn't go through what I went through. So a big part of what we're doing is when we are actively looking for partnerships, when we're actively looking for individuals to help support us in the training process of these students, are people of color. Are people that look like the students that we're working with. And I've seen a huge increase just in that alone. The webinar that I had talked about earlier, I had a student come up to me afterwards from one of our sites, and she said that, she felt that now she's like, I didn't think that I could be a psychologist, but you know what, maybe I can. And that just came from representation. So the trust works really, really well in looking for that for the students.
Wow. The diversity of our city is one of the things that makes our city so beautiful, and recognizing those cultural differences are just so important because, like you said, that one approach doesn't work for every walk of life. So Monica, thank you for that question. Who else has a question? Who'd like to go next? All right, Zaid.
Hi everyone. Thank you for sharing all of what your organization has done, especially in regards to mental health. As we've heard, like mental health is a very relevant topic, especially amongst Generation Z, which I feel like a lot of us are partaking that generation, are on here today. And so my question for you is, 46% of Gen Z adults reported that their mental health has worsened compared with before the pandemic. And nearly 80% all reported that they wish they had more emotional support at the beginning of the pandemic. Members of this generation are grappling with mental health issues more than any other people from older generations. So knowing this, what is the LA Trust for Children's Health doing to address the ever-increasing deterioration of mental health in members of the Generation Z community?
I totally appreciate that question too. So, you know, when COVID happened, it was just like everything was just shut down. People were cut off instantaneously. And like from an organizational perspective, even our own staff, like not being able to be with each other, to talk in the same way, to meet the same way. We saw that among our staff. But also for our young people, I mean, obviously the one way that we were able to stay in touch with folks was through Zoom. It's not the same, but I was completely blown away by the fact that the fall academy that we had the year after COVID, the summer academy the year after COVID, launched, there were so many students in that summer academy because the need for that kind of connectedness and support was so critical. So, you know, we did not let go. We just said, we're going to continue. We're going to do it through this platform. It's the only way that we have right now. But I also feel that what we talk about during those sessions about connectedness, about social support, about, you know, feeling afraid is normal, and there's people to reach out to about that, was really critical for young people through that time. It wasn't the panacea. It wasn't everything for everybody. But, you know, I mean, it was one way that we were able to, we didn't let go of our young people. That's what we did.
Yeah,
go ahead.
So we established a hybrid model when we came into dealing with the pandemic. So the students we were meeting with them once or twice a week for 1 to 2 hours on Zoom. We were engaging with them more so on social media. Something that I think that has affected the Generation Z more than any other generation is access. So there is so much access to information. There's so much access to social media components. And we as a trust have taken that and given it back to the students in a safe environment. So the students are able to utilize social media to connect with their peers and offer other resources. So a big part of our program, it's dynamic. It's offering the students engagement, but also doing social media work. So the students do campaigns through lives, they do stories, they share resources with one another, all within their community. So that's been, I think, pretty critical for us when we're engaging with individuals that are having mental health issues because of the pandemic.
Yeah, and I'll just add to Noe, the idea about social media is great, but it's also dangerous, right?
Yeah.
So we saw a lot of exploitation happen with young people, but that was another thing that we had to lift up. It's like, how do we make sure that you have social media hygiene practices so that you're not going to be exploited in that space?
So we've really taken, you know, everything that's gone on and tried to give it back to the students to make them feel more empowered. The social media hygiene is a training that we do with our students to understand the dangers of social media and how to navigate it safely. So it's been pretty successful so far.
Wow. And are all these resources on your website, or how do folks find that?
Well, the resources we've created either through the trust or we've had partnerships that have supported us in getting those information. Follow us on Instagram. We have 15 Instagrams. We can share them with you all later. Each individual student advisory board has their own Instagram, and they utilize that to support within their school sites. And we post a lot of those resources there as well.
Yeah, and I think you were asking about the training and where does all this happen.
Yeah.
So we actually have a training module that's on the website, right? The SAB curricula.
Yeah.
And so, you can see what's laid out for students, and they have a calendar. It's month to month.
That's great.
Everything like sexual and reproductive health, substance use prevention is like really big. I mean, at LA County, we had 2 fentanyl deaths.
Yeah.
So it's like there's a lot for young people to like arm themselves with in terms of information and protection.
That's great. Because that's what we're all about, is just identifying resources and elevating the awareness of their existence so that young people can access trusted sources of information. So great question. Thank you, Zaid. Who'd like to go next? Asha. And then we'll go Asha, Daniela, and then Kimari. Asha, go ahead.
What are some examples of how the student advisory boards influence the organization's programs?
That's a great question. And honestly, this is something that we've talked about earlier, is student voice is extremely important to us. We include them as much as possible. So we do a lot of either focused interviews, we do focus groups, we'll do surveys, and we'll talk to the students and be like, hey, this is what's going on. How do you want support? We surveyed about 100 of our students at our Youth to Youth conference last year, and so much information came from that really dictated where the agency went after that. So we asked a question similar to, if you're in crisis, who do you go to? And 62% of 100 students said they would rather go to their friend than they would to an administrative staff, to a parent, even to a sibling. So knowing that information, we'll take that back and we'll really focus on a peer-to-peer model, a peer-to-peer support, because what's going on is people are in crisis and they're not knowing where to go. So that's where the Student Advisory Board really comes in handy for that.
Yeah. Great question. Thank you. Thank you, Asha. Daniela?
Hi guys, thanks so much for joining us today. My question is relating back to what we're talking about, access and resources. So many young people feel that they can't access mental health resources due to their home situations, whether that be financially or due to the views of their guardians. So how can we navigate distributing these resources to youth in these situations?
Yeah, so this question is a perfect question, and I completely support this. There is a law called minor consent for Medi-Cal services. And that is without parental consent, and it's protective. It was actually created for sexual and reproductive health and mental health for young people. It is not widely enacted by mental health providers, but a young person can walk into a provider and say, I know I have the minor's right to consent for my services without parental consent for the reasons that you pointed out, Daniela. If there's a situation where there's incest in a family or abuse of some sort, or the young person is just like carries the burden of supporting their parents and doesn't want to burden their parents more just to get themselves on the right footing, they can walk into any mental health provider or the school counselor and say they understand about minors' rights, and we have resources to share on that. But that was created out of child protection.
Wow.
So on top of that, not only do we arm our students with this information, but a big part of the Student Advisory Board is working with the wellness center clinics that we have with their school sites. So the LA Trust staff member there works as a liaison for the student, the center, as well as LAUSD administration, and we're able to support the student in getting those necessary resources if needed. There's Healthy Start navigation support at the school site. There's also touring of the medical centers so that the students are safe, they feel welcomed, and they understand who to go to. So I think that's a really critical component of the Student Advisory Board, that we have the wellness centers on campus, and we have the ability to support the students in getting that information and ability to see the sites.
Yeah, and there was a study that was done in the state of California asking parents throughout the state, do you know about minors' right to consent or no? Most parents didn't know,
right.
But when they were asked, would you prefer that your child, when they needed support, went to someone with clinical background? 100%, almost 100%.
Okay.
I think the total number was about 97%. This was done maybe 20 years ago.
Yep.
But it doesn't change. I think young people should, and this is part of our program too, to like inform parents that this is a student's right and they should know about it. And it's not necessarily, to go behind the parent's back, but just to make sure that the young person gets the care that they need when they need it.
Right. So if I'm a student and I'm not feeling okay, and I know that I want to talk with someone, where do I go? How do I start? Who do I talk to?
So there's a lot of different resources available. You could speak to the PSW, which is a psychiatric social worker on campus. If your school site has a counselor, you can reach out to a counselor. But we encourage you to even speak to a health teacher. Anybody that makes you feel safe on a campus will know where to send you, to refer you to for support. The students at our student advisory board are also taught on different topics such as how to help a friend, question, persuade, refer. What do we do if our friend's in crisis? Yeah. They're informed of the resources that are on campus, and they're informed who to go to during those instances. The difference between a handoff model, like if your friend is feeling in crisis and you say, oh, just go to the nurse, there's a 50-50 shot that individual is going to go seek support. But right. Our students are informed that that difference of just walking them to that nurse's office can be the difference between an individual that could commit suicide. So it's really just asking anyone on campus that's an administrative staff for support, or asking even your peers.
Got it.
Yeah, and there was a lot of virtual opportunity now. That this is what COVID created, and I think it's very valuable for young people, but a lot of young people want to see someone face to face.
Okay.
So there's a value in that, and in LA County there's Teen Line, yeah, which is a great resource, and that has been around for years and years and years, and it's run by young people, and they're trained to be crisis intervention voices on the other end of the line. So more, I guess, education around all sorts of access points is really critical.
Yeah, that sounds like another resource that we need to amplify, because what if I don't want to talk to somebody on campus? Right. I'm embarrassed, or I'm just feeling like some kind of way that I don't want to talk to anybody.
Yeah.
Having something like a Teen Line number to call where I'm kind of anonymous and not having to walk into an office and ask somebody who's going to ask somebody, and then I'm like, oh gosh. Yeah. That's great. So yeah, these are all great resources, I think, that we need to amplify for sure. Thank you for that question, Daniela. Kimari, you have a question.
Yes, I do. With Black students making up over 31% of in-school arrests, how is the LA Trust for Children's Health supporting those at-risk students from preventing them from funneling through the school to prison pipeline?
So I'll talk on a policy level, and then you can talk on the student level. So we just recently looked at school policing and the impacts of school policing, specifically around substance abuse. And I mean, substance abuse is an issue, and it also is sort of a calming mechanism for young people to, use weed to get calm. But, that's not the answer. It's more like, how do we build the fortitude of the individual to do better? But we looked at this, we understand this crisis was big. As you said, Lisa, in the beginning, it's it's not only COVID, it was economic, it was racist, and it was bold and broad, and it was deep, and it cut our young people intrinsically. So, the idea that a young person might smoke weed to calm down or whatever is understandable to some level. We need to focus on harm reduction. So we looked at school policing policies across all of LA County, and some of them need to really reform into a way more restorative justice focus. So really pushing that, that sort of policy change is some of the work that we're involved in from that level. And then
for students, I think one of the big things that we're trying to do now is bringing about awareness, right? So we work very closely with almost all the psychiatric social workers on campus. So the students that are there, they're elevate issues that are going on within the community site, policing, things like that. And we're supporting the students in how to get access to different resources. So if they come on board and they want to elevate an issue such as what we were talking about before, we utilize the administrative staff to support them in that. We also establish clear career pathways with the students, and we let them know that they have access to other forms of services.
Kimari, you had a follow-up?
Yeah, just from a student perspective, let's say that a student is incarcerated and it's deemed as they're a danger to they're a dangerous civilian and they're a threat to the public. How could a student receive the support that they need to say, in the courtroom setting, hey, the student is not a danger to society, it's actually a danger to themselves, therefore we need to treat this person as a patient versus a criminal?
Yeah.
How does your department help with that?
Yeah, so that
Or
area,
even just
yeah, so that area isn't where we have a specialty, but like partners that do, for instance, in LA Unified, there's a special services division that does that kind of work, like bringing newly transitioning young people who are coming out of like juvenile camps into school again to give them the support that they need. But there's also a program called CASA, which is a court appointed special advocate. And that, if a young person doesn't know that that's out there for them, those are people who are trained to help them navigate the legal system so that they are protected throughout.
Wow. So much great information and so needed. And we know the more that we talk about student health services and student mental health services, the more we're able to normalize this conversation and bring about resources for young people to access. So it definitely, helps us, like as an entire city and an entire youth population, to get on this path to healing.
Yes.
So thank you for the great work that you do. Thank you to our youth council members. We know that in the last year that we've been working together and talking with young people across the city, that mental health services always comes up as one of the top 3 requests for services. So, it's innovative programs like yours and elevating this conversation with our youth council members and really getting information out that is going to make a difference for all of us. So, thank you for joining us for another episode of Protest and Promise. I'm Lisa Salazar, General Manager of the Youth Development Department. Thank you.